Hello, I'm Dr. Harpal Bains. I want to talk a little bit about the different types of testosterone because we do get a lot of questions as to what's available in the UK, what we use, and what's the best really. And it's understandable because it's quite a big commitment to actually decide to go and start using testosterone. And also, if you were to read online, a lot of the information is American and some of it is not relevant in the UK. So what we do in this clinic is we have our topical creams. Now these are not the same as what's available on the NHS. We get them specially compounded, and so the dosages tend to be quite different from what's available within the NHS. We can also specify it and tweak it exactly to what the patient needs so that you get exactly what you need. We also prefer to use this thing called a liposomal gel, which has higher bioavailability, which means it gets absorbed much better. So you do get more of the testosterone. The advantage of this is that it's a daily dosing, no needles, which is absolutely great. And you just apply it onto your skin, maybe upper thigh or the abdomen, and you do the same thing every single day. And that's it really. A lot of patients really love it. They've been using it for years. Most will probably not stop using it this way just because of the convenience, and you can carry it with you when you travel. And I think the best thing about testosterone creams and gels is the stability of dosing. Because you're applying the same amount every single day, it feels very stable. It just feels like normal. This is what it's like normally. I would say the biggest difference between creams and injectables, where with an injectable you're giving a loading dose, it goes up, there's a peak, and it comes back down again. And with the different testosterone injectables that are available, you'll get this picture differently for all of them. So let's take the one of the commonest, which is sustanon. Now sustanon is made up of 4 different esters. Esters are basically like a carrier. So each ester will carry the different testosterone through a different time period. So you may have this particular ester that lasts for perhaps 3 days, another one that starts to have an action in 3 days, bringing you to day 6, and so on and so forth. So it's called sustanon because of its ability for sustained release. And so for something like sustanon, you can inject once every 2 weeks. And for majority of people, that works really, really well. The biggest disadvantage of it is that it's suspended in peanut oil. And we have found that even for a lot of patients who claim that they don't have peanut intolerances, generally the injections tend to be more painful than other people. But for those who can tolerate it, it's brilliant. It's wonderful. It's good value, and they love it. Another one that we do is testosterone enanthate. Now testosterone enanthate is carried in castor oil, which the body prefers much more than sustanon. It only has a single ester, so which is quite a long-lasting ester. So for this one as well, you can either inject it once every 2 weeks, or some people half the dose and inject it once a week, which is possible. And occasionally we also have patients who try it for every 3 to 4 days in a much smaller dose. So it's not really a one-size-fits-all. You can do quite a few different things with it, which then brings me to what's commonly used in the NHS in terms of injectables, and that is Nebido. Now Nebido, in the NHS, they normally give it once every 3 months. The problem is, in order for something to last for 3 months, you can imagine that it's a large amount. It's about 4 ml versus 1 ml for the other forms of testosterone. So it's a large dose that you're injecting at a time. The peak is quite high and then it drops quite low. So during the peak, you can get some signs of testosterone excess as well. Doesn't happen to everybody, but it happens often enough that I feel like I need to mention it. And I personally believe that 3 months is a little long for Nebido. Most of our patients find that by about 8-9 weeks they need their second dose. We don't have a lot of patients on it, but it is very, very convenient for someone who doesn't want to do too much, doesn't want the hassle of a daily application of creams, doesn't want to have to inject all the time, and they're happy to do it every sort of 8 to 12 weeks. And they travel a lot, so it suits their lifestyle. So there is a place for it, and it is very useful. It's suspended in castor oil, so once again the body quite likes it. I also want to cover another testosterone that we do, and that's testosterone cypionate. This one you'll find it mostly in the US or Canada. With cypionate, it is suspended in olive oil, and because of that, it's actually a lot less viscous than the other testosterone that's out there, which means it's more fluid. It's much easier to inject. Many patients inject it subcutaneous and not into the muscles, which means it's less painful. It doesn't last as long, and because of that, generally a smaller dose but more frequent dosing, so perhaps 2 or 3 times a week, depending on different people and depending on where they are during their testosterone journey. But this one is by far the one that patients prefer the most. Supply issues do exist with this, but besides that, most people do really like testosterone cypionate. That's what's available in the UK. And if you have any questions, please feel free to get in touch with us. We would be very happy to discuss more with you. Thank you.